To continue what I was speaking about in relation to fluid balance disorders or fluid imbalance, we have three main types of fluid imbalance or water imbalance or water balance disorders. We have hypovolemia, which is the most common form of water imbalance or fluid imbalance. And we have normovolemia with maldistribution of fluid inside and in between the different body compartments. So there might be normal volume, normal body water volume, but there is maldistribution, that is wrong distribution between the compartments. That's one compartment at the expense of another compartment. Maybe it is the intracellular is loaded while the extracellular is depleted, or the reverse, the extracellular might be overloaded while the intracellular is depleted, but still the general total body water is constant, is within normal, but there is problem in the distribution in between the compartments which I mentioned, intra and extracellular, or between the interstitial and the intravascular, or between the intravascular and the transcellular, and so on. So this is normovolemia with maldistribution of fluid between compartments. Number 3 is hypervolemia, that is water overloaded states of the body, or the hypervolemic states of the body, in which there is excess water load and water accumulation and water retention, as what happens in organ failure, in congestive heart failure, or in renal failure, or in liver cell failure, as we all know, the hypervolemic states. But the most common among the three is the hypovolemia, and this is the most common fluid or water imbalance we meet in clinical practice. And the most common causes of hypovolemia is trauma in clinical practice due to blood loss. And number 2 after trauma is dehydration due to water loss. But generally the causes of hypovolemia, to be more and to be understanding it more broadly, they are a loss of blood through external or internal bleeding, hemorrhage, and this is as exemplified by trauma and road traffic accidents and car accidents and the catastrophes, etc., in which there is bleeding. Happens either external bleeding or internal bleeding, like abdominal bleeding or intracranial bleeding following trauma, or external bleeding like bleeding complicating fracture base of the skull with ear bleeding, or with gastrointestinal bleeding, or with bleeding from the body associated with major fractures, etc. So this is exemplified by trauma and road traffic accidents. So bleeding is another important cause of hypovolemia, whether external or internal. Loss of plasma, as what happens in severe burns. So burns, there is loss of plasma from the body, or a loss of fluids due to excessive vomiting or diarrhea, or as what happens in gut infections or gastroenteritis or poisoning, food poisoning. There is excessive vomiting or excessive diarrhea, whatever the cause, whether it is due to a local cause or other causes of diarrhea or vomiting, severe diarrhea or vomiting, or excessive loss of urine in polyuric states, or in dialyzed patients, or due to chronic renal disease, or due to use of diuretics, overuse of diuretics, or whether the drugs or osmotic diuretic fluids, etc. This cause excessive urination, or excessive sweating, or in febrile illness with loss of sweat from the surface of the skin of the body, that's so in febrile states. So all these conditions are associated with loss of water and dehydration. So whether the fluid lost is water or plasma or blood, there will be hypovolemia. Also, as I mentioned, in patients with taking certain medications like loop diuretic especially, or other forms of diuretic fluids given to the patients, like osmotic fluids with osmotic diuresis, when given for in excessive amounts to the patients, might cause a form of iatrogenic fluid losses, mostly through the urine, and also adrenal disorders causing fluid loss. Because as we all know, the main hormones which control the fluid and electrolyte balance are three. The antidiuretic hormone, which acts on the kidney, and we all know that the kidney is the main regulator of fluid and electrolyte balance, the kidneys or the renal system. And the hormones which act on the renal system, there are three hormones which regulate fluid and electrolyte balance. We should not forget, because disorders of such hormones may cause problems in the fluid balance, as I mentioned at the beginning. And these are the antidiuretic hormone, which is secreted by the posterior pituitary, the neurohypophysis, and being produced in the hypothalamic nuclei, as I mentioned when I was talking about the hypothalamus and the hypothalamo-pituitary axis. So the antidiuretic hormone of the posterior pituitary, number one hormone, important in fluid and electrolyte balance. Number two is the aldosterone, secreted by the zona glomerulosa of the adrenal cortex, the adrenal gland, the aldosterone hormone. And this hormone also is important in the renin-angiotensin, what we call the RAS system, or the renin-angiotensin-aldosterone system, which also regulates the fluid and electrolyte balance. So aldosterone, number two. And number three, the atrial natriuretic peptide or factors, which are secreted by the heart. And also they play a role in the volume overload states, which we see in patients with heart failure. So the atrial natriuretic peptide or the atrial natriuretic factors. And also we have the brain natriuretic peptide, which forms a small portion of the natriuretic peptide inside the body, and plays important functions in the human physiology, namely in the regulation of fluid and electrolyte balance. So the atrial natriuretic peptides or factors. So these are the three hormones which regulate the fluid and electrolyte balance, and their disturbance might share in the pathogenesis of fluid balance disorders and electrolyte balance disorders. The antidiuretic hormone or the vasopressin, the aldosterone, and the atrial natriuretic factors or atrial natriuretic peptides. As I mentioned before, the main regulator of the fluid and electrolyte balance, the main organ playing a role in this regulation, is the renal system or the kidneys, being responsible for the secretion of water or the retention of water through its excretory and reabsorptive functions of the renal tubules, and the hormones and the chemical factors which act on the renal tubules and on the glomeruli. So the kidney is number one organ responsible for this. Number two organ also is the respiratory system, and number three is the skin. So these three organs play a role in the fluid and electrolyte balance, mainly the kidneys, the respiratory system, and the skin. That's why the main disorders causing electrolyte balance are, number one, loss of fluids from the body, as I mentioned, in excessive vomiting, diarrhea, urination, sweating, fever. Number two, not eating or drinking well. That's problem in the intake of fluids through the gastrointestinal tract. So inability or disorders in eating and drinking. Number three, diseases of the respiratory system also might be among the causes of fluid and electrolyte balance, like in patients with emphysema and chronic lung diseases, with hyperventilation. So the respiratory diseases, also kidney diseases or renal disorders, adrenal diseases, also are among the causes of fluid and electrolyte